presentation. Next, we'll have Bryn Denhire with Sonendo.
Patients want to save their teeth, but they don't want a standard root canal treatment. It's with that in mind we developed the Gentle Wave procedure, helping you ensure patients a higher standard of clean. Unlike standard root canal treatment, which relies on both biomechanical and chemomechanical means to remove infected tissue, the Gentle Wave procedure effectively cleans and disinfects while conserving precious tooth structure. Simultaneous cleaning of all canals, deep into dentinal tubules, isthmi, lateral canals, and other complex anatomy is accomplished through a proprietary technology that leverages multisonic ultracleaning, advanced fluid dynamics, and accelerated chemistry for improved patient outcomes. A few key features that set the Gentle Wave procedure apart. It all starts in the Gentle Wave console, where the procedure fluids are optimized through a process known as degassing. This reduces the possibility of apical vapor lock and maximizes tissue dissolution, debridement, and disinfection. Fewer files are used. With the Gentle Wave procedure, the job of the file is simply to provide an uninterrupted path for a three-dimensional fill. A sealed environment is generated between the tooth and the Gentle Wave procedure instrument to allow for constant refreshing of degassed procedure fluids and simultaneous evacuation of debris. It's in the procedure instrument that patented multisonic ultra-cleaning technology enters the equation. The stream of optimized fluid entering the tooth creates a powerful shear force, which causes hydrodynamic cavitation in the form of a useful cavitation cloud. The implosion of thousands of microbubbles creates an acoustic field of broadband frequencies, which travels through the fluid into the entire root canal system. Gentle vortical flow is induced within the root canal system with a slight negative pressure at the apex. The result, unique to the Gentle Wave procedure, is unmatched cleaning and disinfection from the crown to the apex. The Gentle Wave procedure, helping you save more teeth for more patients.
So I thought we would open up first with a video just to give you an overview of our technology. So I do want to talk a little bit about Sonendo and who we are. So we have been in existence for about 10 years, and our mission is saving teeth through sound science. So sound science is a double entendre. Sound science being the acoustic technology that you just saw in the video, as well as sound, meaning we have a volume of literature. We are supported by many institutions and universities across the United States and internationally that support building the studies and research that prove that this new technology is 97% effective. Now, when you contrast that to standard root canal therapy, somewhere between 60 to 70% effective. So, bringing new technology into the industry, the endodontic space, that really hasn't had many technological breakthroughs in the last, 200 years, right? Still filing, still using mechanical and chemical means of removing bacteria, biofilm, and tissue from the root canal structure, and now using multisonic ultra-cleaning technology through the Gentle Wave system. It's just a really incredible technology, and I'm going to show you how you can bring this into your practice if you're already doing root canal therapy, or if you'd like to. So again, I just want to give you a high-level overview of how this is accomplished. It starts in the Gentle Wave console that you see there on the left-hand side of your screen, and we degas the procedure fluids. So the procedure fluids are the fluids that you're familiar with in root canal therapy: sodium hypochlorite, EDTA, distilled water. And within this console, all of the fluids are self-contained. The console itself actually brings the concentration down and degasses the fluids. So, what's degassing? When you have air bubbles in your procedure fluids, it can create apical vapor lock. And apical vapor lock can avoid cleaning the apical third of the tooth. By degassing the fluids, we're able to clean from the crown to the apex, into lateral canals, and deep into dentinal tubules. So here's the procedure instrument. It actually doesn't enter the root canal structure. So So what you'll see here is it creates a sealed environment between the procedure instrument and the tooth. The fluids come down from the console through the procedure instrument into the tooth and into the root canal structure. When those fluids hit the impingement plate, it creates a cavitation cloud of micro bubbles, and those are fluid bubbles. Remember, no air bubbles within the root canal system. And when those micro bubbles implode, it creates acoustics. Now, what do acoustics do for us? It creates energy that drives tissue dissolution. I'm going to show you a video that's representative of tissue dissolution that would happen within a root canal structure. So this is a piece of bovine tissue. And again, the fluids are coming down the tip of the procedure instrument, hitting the impingement plate, and creating a cavitation cloud. Again, when those microbubbles implode, it creates acoustics at many different waves of frequency. And it also induces vortical flow. There's slight negative pressure at the apex, and so we'll look at the volume of clinical literature that talks about safety. But by combining the acoustic technology as well as the fluid dynamics, you can see the valuable tissue dissolution that would happen within the root canal structure. So this is not sped up. This is within about a minute. And the entire procedure, pardon me, the entire procedure takes about 8 minutes. Fantastic. So the criticality and really the contrast of standard root canal therapy and the gentle wave procedure is the ability to have minimal instrumentation of your root canals, so dentin preservation, matched with maximum cleaning and debridement. So we don't have time at this moment, but I invite you to booth 1255 to talk more about the literature. Again, we have a volume of clinical support, all the way from cleaning and disinfection to healing rates. We were published in the JOE last year for 12-month healing. And again, patients showed signs of healing at 97% in 12 months, which is incredibly quick. And I did just want to bring up one study for you with some really great imagery. So this was a study at UCSF. And so on the left-hand side, you can see a root canal with no treatment. And we've colorized it for you so you can see the variety of bacteria that exists in a tooth that requires root canal therapy. We have compared that with active ultrasonic. And so you can see that the volume of bacteria have lessened a little bit. But unfortunately, with the introduction of active ultrasonic, you can see smear, you can see biofilm as well. And then all the way on the right-hand side of the screen, this is the gentle wave procedure. So not a lot of people have actually seen the image on the right-hand side of the screen. This is untouched, completely clean dentinal tubules at the apical third. And this is what the gentle wave procedure produces. So when you incorporate the gentle wave procedure into your practice, it, of course, is about efficacy. When you can deliver this value of efficacy to your patients and for your practice, that allows you to go from perhaps a 2-visit procedure, where you're packing the tooth with calcium hydroxide and seeing the patient again a few weeks later, and instead a 1-visit procedure. That adds an incredible amount of efficiency to your practice. Combine that with the technology that patients are looking for. They want to save their natural tooth. This is an alternative to standard root canal treatment for patients who want to save their teeth. So patients are looking for this. Referrers, if you're an endodontist, respect this, absolutely. Bringing this technology into your practice allows you to stand out from your competition, attract patients and referrers, and increase your profits. So we encourage you to come by booth 1255, and we can have some in-depth conversations about the technology, the efficacy, the efficiency, and the economy of the gentle wave system. Thank you very much.